Good evening, everybody. I hope everybody is doing great. I want to welcome you to a very special webinar tonight. It's brought to you by Align, the makers of Invisalign, and PROPEL, the makers of PROPEL and VPRO. I'm showing you my webcam to start, but we have a lot of moving parts on this system we're working on tonight on the GoToWebinar system. So we're going to shut down the webcam. So those of you who know me know what I look like. Those of you who don't, here's your look, and webcam is done, so we can clear the screen a little bit. So we are good to go. So I am going to welcome you once again, and tonight we're going to talk about basically how we can make these Invisalign treatments as easy as possible. So I am going to walk you through the steps I do and the processes that I use in my office. This is me. I am from Miami, Florida. I have offices in Aventura and Pembroke Pines. I see a lot of my neighbors here, some friends on the webinar tonight. I have over 1,600 Invisalign starts, and I always say that's great, but I only have 7 finishes. And we will come back to that joke later. Remember that joke. I'm a proud member of Align's global faculty. Align named me their faculty member of the year a few years ago, 2 years ago. I am a key educator for PROPEL, graduate of Emory and Georgetown universities. This is one of my proudest business accomplishments, if you will. I came out with a book. I've been practicing for 3 decades now, and you learn a lot in 3 decades. And this is the tips that I put together, and came out, launched just in time for the pandemic. Beautiful time. And this is part of our book launch. So if you want to get it, you can get it on Amazon. You can get it on Barnes & Noble. You can get it on Target's websites. All of them sell the book, and I think they had a Black Friday special still for like 14 bucks or something. So it's a good deal. That's the book, and we're not here to sell it. That's my team. This is a day that our day of giving once a year, where we give away a day of dentistry, and we have given away in 9 years $1,350,000 worth of dentistry in our 3 offices. I am very, very, very proud of that. So does this look familiar to many of you? Well, it does look familiar to many of you. It doesn't even look familiar to me. I'm not going to lie to you, because I don't even have a reception area open yet. But those of you who have your reception areas open, this is what things look like. We live in a different world today. There's no denying it. And we are very much looking forward to getting back as much as we can to the old normal, every single person on this call. So, you know, most of us started off with gangbusters when we went back to work in South Florida in May. We had a backlog of patients waiting to get in. Things were amazing. Things were great. And we kind of knew things were going to hit the wall a little bit, if you will, when we, well, basically, you know, had this 6-month period where we didn't have patients lined up in prior to May. Okay, in April, in that period, we knew that October, November was going to get slow, and things for most offices have slowed down. Some of the things that haven't changed is our staff still needs to get paid, and we have these new things like PPE. I personally have somebody outside of each of my office taking temperatures and screening our COVID patients before they walk in. Every procedure still seems to take a little bit longer between gowning up and our shields and everything else that we need to do, and wash 27 times and glove up and do the things we need to do. And we're trying to get people in less visits. All right. And many of you have seen a lot of your Invisalign starts down recently. Profits are down for many people, and we are in a very, very different world right now. So what's going to make us different? What separates the practices? I mean, we have to be more efficient. We have to provide an amazing patient experience. Can we get quicker again? I think we can, and we will learn how to do that. We have to provide better experiences, more comfortable, better times when patients come to the office. People are nervous when they walk in, and we have to do better than we did in the past. They're not just walking in because they've been our patients for 10 years or 20 years or 30 years. We have to work harder than we did before and do things differently. This number is staggering. This is the average number of months for a clear aligner treatment across the country, 20 months. That's over a year and a half the average patient is in their aligners, and they're coming to the office 18 times. If this sounds like you, you're in the right place tonight. If it doesn't sound like you're still in the right place tonight. But if you're doing treatments that are lasting this long, we really, really need to tune in and pay attention to what we can do better. So who's the winners? Okay, if we can reduce treatment time, the patients win and we win. If we can reduce the number of visits, the patients win and we win. Every time we put a butt in the chair, if you didn't realize it pre-COVID, but every time you put a butt in the chair, especially with disposables and sterilization, all the different extra sterilization steps and all the different disposable steps and everything else we do, every time we put a patient in the chair, it costs us money. Prior to COVID, there was a number going around. It would cost about $15 a visit just to sit in the chair and say hello. That's what it would cost us in terms of turning the room over and the sprays and the disposable and all the different things, sterilization that we need to do. Post-COVID, I haven't seen the number yet, but we all can assume it's significantly higher. So the name of the game is to finish. You know, when I go to faculty meetings and when I go to the Invisalign Summit, there's always like the Invisalign awards everybody for, you know, the number of cases that you do. You have a status as a silver provider or a gold provider, and but that's for the number of cases you start. The questions they don't ask is the number of cases that you finish. And you might think, well, eventually you're going to finish the case, but when do you finish the case and what's involved in finishing the case? You know, I always ask, I'm always good at the second and third and fourth questions. So if I meet somebody, and like I told you guys, I've done 1,600 Invisalign cases. If I meet somebody and they say to me, you've done 1,600, and I'll look at them and I'll say, you've done 3,000 Invisalign cases. That's amazing. I'll start asking questions. You've done 3,000 or your whole office has done 3,000? It's like, no, I have 17 offices and that's all my docs combined. Then I know that person's not an experienced Invisalign provider. If I ask the question, you've done 3,000 Invisalign cases and you've done them all yourself, that's great. I go, how did you do it? How long have you been doing it? Oh, you know, I just do a lot of Invisalign. What do you charge per case? And if I find out they're charging like $3,500 per case, and that's $1,500 less than I charge, okay, I'll be like, well, you're making $1,500 less profit than I'm making. You have to do a lot more Invisalign than I'm going to do because our numbers just don't add up because I'm charging significantly more. So that finishing game is probably the most interesting question you can ask somebody as far as Invisalign, not necessarily how many they finish, but how do they finish? Because I think that's significant. You know, are they doing refinements? I know people do refinements on every single case, additional aligners on every single case, and we're going to see that that's not what you think it is. There's a serious number in terms of cost involved with that we need to discuss tonight. So, you know, when you hear about orthos do things a little bit different than us because they have better systems. They're set up to do these. You walk in an ortho office and that orthodontist is a conductor. They have assistants working left and right and putting the wires on and scanning the patients and doing the clin checks and doing all those things. And we have a little bit different setup, okay? We do the same software they do. We have the same training do. We get the same aligners they do. When we're doing PROPEL, we use the same products they use, but their efficiencies tend to be better than our efficiencies when it comes to tooth movement and orthodontics. This is not what the orthos are using, though, just to make clear. Every chance I have to put this slide up, I do, because it's real. I actually had a patient come into the office and he lost a device that we were using to seat an aligner. This is actually before I was using PROPEL and VPRO 5, and he created his own device to seat aligners. This looks like a tire because it is a tire. I don't know how many plies that tire is, but he actually did this himself and used an old tire, cut it up, and was seating aligners with it. So every chance I get to show this slide, I like to throw it in there because it's so funny and ridiculous. Okay, what else do we have? We have these direct-to-consumer products. All right, you should be thrilled when a patient comes in and says to you, what do you think about Smile Direct Club? Because that gives you the opportunity to address how ineffective Smile Direct Club is, how ineffective their technology is, all right, how there's no attachments, there's no doctor supervision, how many Better Business complaints they have against them. And by the way, it's like 2,000 Better Business Bureau complaints against Smile Direct Club, how they force people when they give them a refund to sign a release because they don't want anything posted online bad against them. So they go to great pains, but you're lucky when a patient comes in and mentions Smile Direct Club to you, because there's hundreds of patients that are going out and getting it, many in your practice, thousands and thousands, who never mention it to their doctor, okay? So when we have an opportunity to address a patient who's considering going direct to consumer, that's a red light that goes on. Hey, this guy's looking at a $2,000 treatment. What do I need to do to capture this patient? Is it fees? Is it the quality of what an Invisalign aligner brings to the patient? What do I need to get this patient on track? Is it the monthly payment that I have to get under control? Because that's what people think about. Excuse me. Is the monthly payment. They're not necessarily thinking about the total payment. It's the monthly payment. You all have heard this before when you're dealing with Lending Point and Care Credit and those third-party financing companies. The patients, it's like when you lease your car. How much did you pay for your car? Most people have no clue what they're paying for their car, but they know how much they pay per month. So we have to get better with third-party financing. You have to be more efficient in how you work. And we need to educate our patients better. If you have that opportunity, if they are bringing the facts to you that I am thinking about doing Smile Direct Club, that's your opportunity to educate. And if you miss that opportunity to educate, you're gonna have that patient walk in your office and go, guess what? I did Smile Direct and it worked great. And you're gonna look at it and go, not so great, but okay. And then you decide where you wanna take it from there. But you better not miss the opportunity to educate your patients when they give you the opportunity to educate them. So clear aligners have evolved. Accelerated orthodontics has evolved. We now have better treatment, there's better materials, there's better biomechanics involved with them. And now we have the tools with accelerated orthodontics to make these movements more predictable and get the patients in and out of our offices in fewer visits. Invisalign has been around for well over 20 years now. Virtually any case now can be done with Invisalign. They have over 9 million cases worldwide, and that's not nearly enough. When you hear Joe Hogan from Invisalign speak, he's like, we're missing the boat because there's still too many people doing orthodontics, traditional orthodontics, and not doing Invisalign. There's an audience out there for us to capture, and there's an audience out there for us to capture. So virtually any case can be done with Invisalign now. It's up to your skill set and what you're comfortable doing, but know how Invisalign has grown over the years. It is #1 for a reason. And PROPEL is growing pretty much at a similar rate. It's 10 years of clinical use now. You have 2 treatment options, which we'll discuss, one that's done in the office, one that's done at home. And PROPEL is quickly approaching 1 million patients worldwide. So it is not new. It is not something that you're doing experimental procedures on your patients. This works, and they have the track record to prove it and all the documentation study to prove it. So if those of you who have never tried it before or have dabbled in it and saying what's going on new with PROPEL, you just need to get the facts and you will embrace PROPEL and VPRO just like I have. So we're going to talk about profitability a lot tonight. This is one of my favorite lectures because we're going to mix in a little bit of clinical and we're going to mix in a little bit of business, and that's where it all comes together because that's what we do. Let's face it. We're not doing clinical all day long working for free, and we're certainly not doing business all day long because we have to take care of our patients. So we're looking at a patient, 23 years old, pretty difficult Invisalign case for a GP to handle. Treatment time here was 33 months, almost 3 years. 50 aligners first go round, 34 aligners second go round, 84 aligners in total. Can Invisalign do this? Yes, Invisalign can do this case. Would I treat this case? No, I would not treat this case. Why wouldn't I treat this case? How much do you have to charge this patient to make it a profitable case for you? Now, there are those of you who are on here tonight who go, I would do this with my eyes closed, no problem. You need to learn the economics of clear aligner therapy to really understand if you're going to tackle a case like this that is going to get into potentially 84 aligners. Nothing to do with your skill set. This is an economic decision that you're making here right now. How long is this case going to take approximately, and what is it going to cost you? What can you charge a patient for a case like this for it to remain profitable? So Invisalign can do the case. Would I do this case? No. 1,600 cases later, plus would I do this case? No. So some tips that I want you to fall into. I say once a case gets to about 35 or 40 aligner case, you may want to consider referring that case out unless you are charging significantly more for a complex case. If you have one basic fee structure, okay, if it's 5,000, 4,500, 5,500, whatever you're charging, that's fine. But if you're getting to a complex case and you're not, and you have the skill set to do that complex case, that's great. But you better charge a significant fee to make sure that you're covering your time involved with that case. Educate and scan every patient that you possibly can. Some of the patients you can't, especially if you practice in my neighborhood, a lot of people are running in, running out. All they want to do is get their teeth cleaned. Let me know if I have a problem. They won't even get in discussion with you. They don't value what they're doing lots of times and what you need to do lots of times. But every patient that you can, you need to scan and you need to educate. And when you hear no from a patient, you need to understand there are some circles, no means no. But when it comes to dental treatment, when a patient says no, we simply interpret that as not now. And they might come back a year later, 2 years later, 3 years later. When they're ready, they're going to be ready. And their lives could change. They could be in a situation where they are getting divorced. Maybe something else changed with them socially. And now they're ready to align their teeth properly. You want better compliance from your patients. If you had all of your patients 100% compliant, 22 hours a day or more every single day, that would be amazing, but that's not reality. So one of the things that we help overcome compliance with, which we will talk about, is use of the VPRO, and the VPRO will allow the patients who aren't exactly 100% compliant to stay on track. We can recover from that non-compliance versus doing refinement by using the VPRO to what we call supersede those aligners, okay, to get the patient back on track. It is very, very important for you to realize that we have to keep the patients on track. I think one of my biggest roles that I have to play as an Invisalign provider is to be a cheerleader for my patient. If I'm a cheerleader and keep them on track, I'm doing my job. If I'm not a cheerleader, I'm not doing my job. So it's very, very important that I continue to do my job and keep them on track, and that way I get them done efficiently, and that's the name of the game at the end of the day. So let's just talk general terms. If you have a dental procedure that nets you $400, but it takes you 10 visits to complete that procedure, is that worth it for you to do that procedure, to make $40 a visit, knowing what it's costing you to have that patient's butt in your chair alone? $40 a visit is not a profitable procedure for a dentist in 2020 or almost in 2021. So you really have to look at the economics here. If you're doing a procedure like this, you need to do something to minimize the number of visits if you're only netting $400 and make it worth your while. And everybody has a different number that they like to drive out of their chairs each visit or per hour. So it's very, very important you get it right. So let's look at some numbers here. So if we're looking at Invisalign case fee, okay, and this varies, but I'm figuring basically based on a national average here of about $5,800 for a case fee, what you would charge a patient, including Vivera retainers. Now, some of you are on the Advantage program, you pay less for your aligners, but we're gonna round it out to about $1,800, which is a little less than the 18 and change they charge, and Vivera's about $300, which is really $275. So the two numbers level out to about $2,100 for the total lab bill. That gives you a gross profit, and this does not include your assistant, the electricity, your sterilization, your PPE, and all those other things, but that gives you a gross profit of about $3,700. If something takes you 15 visits to do, if that case takes you 15 visits, you're netting $247 per visit. And you can do the math, and it goes, numbers increase the less visits that you have. So if you get a patient down to 5 visits, I think almost everybody on this call would be very happy to make $740 per visit, day in, day out, all day long. That would be a very nice profit per patient. Now, if we put the PROPEL or VPRO into the case, and you're looking at a case here, and we gave you a very high fee. This is not a discounted fee for PROPEL. The more you buy PROPEL, the lower the fee goes down. You can get this fee down to under $300 if you buy many PROPELs at once, or VPROs at once, I should say. But if you introduce this alone, your lab bill goes up, your profit goes down. And my argument tonight to you is you're not going to be seeing patients, that same patient, over 15 visits. So that's no longer applicable. But if you just introduce a VPRO into the case, all right, your profits still stay up pretty high because you're seeing the patients in less visits, 5 or 10 visits. That's the purpose of this slide. If you introduce a VPRO into the case, you're going to reduce the possibility of extending the case out more visits than necessary. Now, same slide, but in this slide, we're going to charge for a VPRO. In the previous slide, we didn't charge. Here we didn't charge. Here we charge. So we put on a $600 fee. So now we still don't have that that 15 visit procedure because we are using a VPRO in the case, but your gross profit is up and now your profit per visit's up. So if you used a VPRO, introduced it and charged for the VPRO, you're actually ending up more profitable than if it becomes a profit center for you. So you need to understand that the dollars involved per visit and each time these cases get extended out. Those of you who believe that there's no charge for additional aligners from Invisalign, you're fooled. You're right. You got it. You're not going to pay an additional lab bill, but there's a serious cost involved every time you have to have the patient back in. Taking attachments off, putting attachments back on, more chair time, stressing your staff out because that patient's not wearing their aligners. There's so many different factors getting into when the cases take longer, more visits, things that drain your practice, the happiness level of your patients when these cases take longer and longer and longer. If a case is taking 20 months to get done versus 6 months to get done, what do you think the happiness level of that patient is at the end of the day? Is that 20-month patient going to refer patients to you, or is that same patient, if you got the case down to 6 months, going to refer their family and friends to you? I can't tell you how many times I have patients come to see me because they say to me, my friend told me she did Invisalign with you and it took her 6 months, and I know my case is exactly like hers, which we know it's not. And I had a dentist tell me there's no way he can do the case in less than a year. So time is not just money, time is patients coming and becoming your patients, and that becomes money at the end of the day. So know the value of introducing VPRO into your case, and if you charge for it, it actually becomes a profit center for you. So let's take a look at some more numbers. That's the number I just gave you, this number 2, this number 2, and this breaks things down per hour, okay? 2 to 3 hours is what a case should take you if you're doing it efficiently. 2 to 3 hours chair time. There's no procedure that's more profitable for you than a good Invisalign case, okay? How are those numbers per hour? $1,200 to $1,800 per hour? I would only work a half a day if I had Invisalign patients all day long doing that, okay? And my wife would know what to do with me when I got home at 1 o'clock every day, okay? But that just shows you the power and the profitability when you do these cases efficiently. Flip it. Now you have additional aligners, refinement. Your profit was here, $1,200 to $1,800 per hour. Additional aligners, there's your profit still, but your time involved in the case doubles. Your profit cuts cut in half from $1,200 to $1,800 to $700 and change to $900 and change. So you have to get these cases. You have to do everything you can to finish a set of, you have to do everything you can to finish your Invisalign cases in one set of aligners. Those of you who are stretching this out to another refinement, and the patient, oh, can you turn this tooth a little bit more? And this one's not exactly where that one is. And when I pull my cheek back, this one's sticking out a little bit more, and this one's set in a little bit more. You know, those patients are going to drive you crazy. You have to do everything you can to finish these cases in one set of aligners whenever possible. There are times you're just not going to be able to do it, but you need to stack the deck in your favor. If you're not finishing it in one set of aligners, you want to do as few aligners in that set of refinements as possible. Here's the VPRO. It is 5 minutes a day. That is it. The patients will ask you, it's so easy to do. My patients say to me, they go, can I do it more? And I'm like, absolutely. You can do it more if you want to do it more. It's not going to hurt you to do it more. It's just going to stimulate the bone and soften up the bone basically so we can get good movement of the teeth. It is going to increase our inflammatory process, which we'll talk about shortly, and that's going to make the teeth move easier. So if you want to use it more than 5 minutes a day, that's great. Here's the PROPEL devices. The PROPEL devices are used if you want to do in-office treatment. It's an in-office solution, and we'll talk about this. I've never done one of these webinars before, live or a webinar where I didn't have somebody ask the question, when do you use PROPEL and when do you use VPRO? We'll talk about that shortly, but this is our in-office solution to make the case more predictable. If you wanted to speed up the case, you can do that too. I am not going to lie to all of you tonight. I am very good at 1 week aligner changes. That is my sweet spot, and I'll show you why shortly. I don't have to change aligners in 3 to 5 days. Some people really push the envelope and look to do that when they're doing the VPRO or when they're doing PROPEL in the office. But for me, I'm doing 7 days, and I use these to make my cases more predictable so I can get the case finished on time. The key to VPRO is high frequency vibration. This is the one and only, okay, vibration device that works. Okay, there are other ones out there. We have the patents on this. Okay, it is our first line of defense. It is when I present it to my patients. Here's your Invisalign. Here is your VPRO, and I explain the importance of the VPRO in their case. That it will require less office visits. Their aligners are going to fit better. They're going to have less. They're going to have less discomfort, and their movements are going to happen in 1 week versus 2 weeks, like half the country is still doing, changing aligners every 2 weeks. I don't tell them it's a superseder, that if they don't wear their aligners good. I won't tell them that. I won't tell them it's going to recover from lag, and I won't tell them it's going to, help in a relapse situation. I really focus on those initial points, those first 4 points. Less office visits, more predictable, reduces discomfort, and I can do your case where we do 1 week aligner changes and not 2 week aligner changes. Again, here's our second line of defense, if you will. This is our PROPEL. This is a great device in terms of delivering the PROPEL. It makes it quick, it makes it easy, okay? And but for me, I am still comfortable only changing aligners once a week. I do not go as quick as 3-day changes, which some people do. Now, to answer your question that I know you're going to ask, it takes about 20 minutes in the office. When do you use PROPEL? When do you use VPRO? So oftentimes, if I know I have one tooth that is going to be problematic in the mouth, and I need to focus on that one tooth, and I have a patient that may not be the most compliant, even wearing their aligners, and I'm afraid to send them home with an in-home solution where now they have to wear their aligners and find 5 whole minutes a day to use the VPRO, I will use the PROPEL in office, and I will use it in office with the patient. So if I'm looking to do something where I don't want to bog down the patient with one more thing that they need to do, because that's not what they initially signed up to do, and I have one tooth in particular, that's where I'll oftentimes choose to use the PROPEL over the VPRO. Once again, we don't see a lot of root resorption with clear aligner therapy, but because we are softening up that bone is what we're doing, temporarily softening up the bone through the inflammatory process. That will allow us to have virtually no possibility of having root resorption because the bone is accommodating the tooth so well. So there's a lot of science. There's 100 years of science behind this. Your PROPEL rep will be happy to present tons and tons of literature to you, okay? My PROPEL rep and many of yours in South Florida, Jim Sieg, will provide you with any information you need necessary, okay? There's over 600 peer-reviewed clinical trials when it comes to micro-osteoperforations. Those are the tiny little perforations that we make with PROPEL in the office, and the literature's all there. It's proven, it works, and all you need to do is gain a little bit of knowledge and read a couple articles about how effective it is, and you become a very happy user of PROPEL or VPRO in your office. This is what it looks like 5 minutes after it's done. Tiny little micro-osteoperforations. That's why we call them micro-osteoperforations. They're there, they're small, they're tiny, and they heal up super, super, super quick. And you don't really have much to worry about post-op pain. You just want to make sure you get the patients real numb. Once you get the patient really numb, you don't have an issue in terms of post-op discomfort. So that's what it looks like literally 5 minutes later. Now, I know there are some of you on this call right now who have done this, and I cannot discourage you enough to try to do this with a burr. This is not about making a hole, okay? This is about a micro crack is what we're trying to do. When you are taking a high-speed burr to the bone, you are beyond playing Russian roulette. It might work. It might work. But the downside of taking a high-speed burr to the bone that's not approved, if you have an issue and you get heat necrosis in the mouth, or if you hit a root with your high speed, the problems, the upside versus the downside, there's no discussion necessary. I've seen videos of doctors that have done it. I've seen amazing, excellent doctors that I respect that are well-informed and knowledgeable who brag about how they take a high speed in lieu of spending the money on PROPEL. They rather spend $1 versus whatever PROPEL costs, 100, 150 bucks, whatever it is. And this scares me to death. I practice in a low risk as possible. I don't want to brag when I tell you nobody in my practice has ever had a lawsuit against them. And there's a reason why we would never do anything like this in our practice. And I highly discourage you from ever even trying anything like this. All right. The accelerator devices here is the one and only device cleared by the FDA for use in micro-osteoperforations. Nothing else. Anything else you put in your mouth, if you ever have an issue, just call your malpractice company and tell them to settle the case, because you got no science behind you. There is no FDA approval for any device that you're going to use besides PROPEL if you want to get the patient to have the proper micro-osteoperforations to make the case more predictable or to accelerate the case. So I think I've exhausted that enough. They're easy to learn, okay? Often misunderstood. It's not about making a hole. It's about creating compressive stress, and those compressive stress will make radiating micro cracks, and that's what changes the bone chemistry. When you make a hole, you are making a hole. When you're creating compressive stress, you are changing that bone morphology, that bone chemistry, and that's the secret here. So don't fool yourself. Do not cheap out here. This is not like buying a wholesale cotton roll if you want to save a couple bucks. This is something that can be very, very dangerous to your patients. Now, here's the science, and this is about as deep in the science as we're going to get tonight. We always hear about inflammation is bad in the body. True, except when it comes to tooth movement. Aligners cause an inflammatory response. That's why we tell our patients not to take any aspirin. That's why we don't want any anti-inflammatories taken, because we want cytokines. We want osteoblasts. We want osteoclasts at work. That's what causes the bones to remodel. When we introduce micro-osteoperforations and or VPRO, that just amplifies the process, okay? The osteoclast is what eats away at the bone when we're moving the tooth. In this case, we're moving the tooth buccally, if you will, or I'm sorry, it looks measly, I take it back. And the osteoblasts are making bone, and they don't make the bone as fast as we break the bone. That's why teeth may show mobility during tooth movement. That's why retention is very important at the end, and we'll talk about that shortly. But here's the process right here. When you are using MOPS or VPRO, you're amplifying that inflammatory process, creating more cytokines, more osteoclast activities. That causes more bone remodeling, and that's what makes your case more predictable when you're using MOPS or VPRO. That's your science right there. Now you have better biology. When you are using orthodontic forces, okay, look at the difference with the orthodontic force when you're using a VPRO versus just putting force on the tooth. You get much, much more force. You have much, much more osteoclast cell activity when you introduce VPRO. Looks like it's 5 times the amount of osteoclast activity when you introduce VPRO. Because of this also, and the more circulation going on in that bone around the teeth that you're moving, the aligner seats better, the patients are more comfortable because you have better circulation. That inflammatory process is a good thing in this case. You're not just depending on the aligner alone to move the teeth. Thus, less discomfort, okay? Those first 3 days that you put an aligner in when the action's really happening, you have 44% less discomfort. They've measured the patients with and without VPRO. You look at the bottom of these studies, okay? Many of you have heard of that school, Harvard and NYU. You know, I'm just joking when I say Harvard, but Harvard and NYU, okay? These are very, very, very reputable studies that have taken place for PROPEL to back up their science. This is my favorite part of the slide on the right. If you are looking in terms of aligner tracking, if you're doing 7-day versus 14-day aligner tracking, you're having a difference of 14%. I mean, that's a measurable number. Those of you who are changing aligners in 7 days versus 14 days, I know some of you on this call love the 14-day aligner change, but imagine this, you get a 90% aligner tracking versus the ClinCheck if you introduce VPRO at 7 days. So those of you who are changing aligners every 14 days, imagine doing those same movements predictably, more predictable by introducing VPRO. This is like the mic drop. If you saw me on video right now, that's what I would be doing live, is dropping the mic, because that's all you really need to see. That the most efficient aligner tracking is a 7-day wear with VPRO. You're not going to do better than that, 90%. I happen to tell my patients, if you're 100% compliant, there's a 90% chance that you will finish your case on time. And that's where I get that fact from. That's what you got to do. 100% compliance with a VPRO, 7-day aligner change, 90% accuracy when we're tracking aligners. We measure this when we're using the iTero element because we can compare it to the ClinCheck when we scan the patients if the teeth are tracking or not. VPRO's been around a little while, okay? We've had 3 generations now, all right? We now are Bluetooth compatible, a better battery, all right? You charge it USB charging. Of course, with everything else, there's an app now to measure aligner compliance. There's so many nice new tools that are involved with the 3rd generation of VPRO right now. So those of you who didn't know the first 2, if you knew the first 2, it's even better. And I always love companies, both Align and PROPEL are always looking to get better. And that's what I love about these 2 companies. And they show serious progress, from Align coming up with better aligner material, better attachment systems, things of that nature. They're always looking to get better Align, and the same thing happens with PROPEL, and that's why I love both companies and speak for both companies. So we're getting back to that 7-day aligner change. So with 7-day aligner change, it's very interesting what Align puts at the bottom of their recommendation for 7-day aligner change. And basically, I hate to read this to you, but at the doctor's discretion, monitor tooth movements such as rotations, extrusion, and significant root movements, particularly blue and black movements in the tooth movement assessment. Depending on the patient response to treatment, particularly mature adults, consider longer periods between aligner changes. So Invisalign is telling you, yes, 7 days works good, but not for everything. So how do we make 7-day work good for everything? And you know the answer, or else you wouldn't be on the PROPEL webinar right now, but PROPEL is the answer. When I say PROPEL, I mean PROPEL, or I mean VPRO. Either one of those is the equalizer. So that takes care of those blue and black movements, those root movements. So this is the way that we equalize non-compliance. PROPEL becomes your friend, that VPRO becomes your friend. So this was a press release put out just a couple of weeks ago about the Invisalign G8 Smart Force features. And basically what it's telling us is it's getting better. That's what I said to you about Invisalign, is we know it's getting better every single time that they come out with new technology. And the new technology is basically saying that they're going to be doing better posterior arch expansion right now. Okay, and they're going to improve on deep bite cases because that's an area where Invisalign is having limited success in some of the things that they're doing. And there are doctors on this call tonight that are doing amazing, amazing things. My colleague, Dr. Coddington in San Francisco, is doing amazing things with expansion and sleep therapy and all the different things. And but he smiles when he hears about the G8 technology, and he's on this call so he can hear about how PROPEL can make the movements more predictable when he is getting very, very into these very, very involved cases of expansion. So this is what Align's doing. It's getting better and better and better, and PROPEL's getting better and better too at the same time. So here's our protocol. All patients change their aligners. I tell you, I do 7 days, okay? There are doctors that get away between 5 and 7 days, even for those advanced blue and black movements. VPRO is prescribed for 5 minutes a day, but 2 times a day on the first 2 or 3 days of a new aligner, because we know that's where all the action's happening, is the first 2 or 3 days of aligner wear. So in those first couple of days, use PROPEL 5 minutes twice a day. Now, this is up to your own discretion, how often you want to see patients, what's involved with the case in terms of IPR and tracking the cases and your individual patients. But there are many, many, many doctors out there who see the patients every 12 weeks and even up to every 16 weeks, okay, after that initial aligner check. So you can spread out the amount of time that you're seeing patients, because you know, why do you see your patients? You see your patients to perform IPR in the cases that need IPR, and you see the patients to make sure they're tracking. Well, how about seeing that now you have great systems available with Invisalign virtual care, that if you don't have to do any IPR, you can track these patients virtually. They don't want to come to your office, especially now. We're eligible to get the vaccine hopefully in another week or two. Okay, but they won't be getting the vaccine for maybe 6 months from now. They still don't want to come to the office. So if we can track these patients virtually, how great is it if we know that the predictability of the aligner is going to be up to 90%, knowing that they're using VPRO at the same time. So if you cut out the visits to your office and see them in shorter intervals, you might see them every 6 weeks virtually, but every 12 weeks in your office, 5 minutes on the phone, or they can take pictures and send them to you, and you can check them at night when you're checking your emails or when you're watching Netflix. That's amazing. So consider doing dentistry a little bit different in 2021, because you will become much more profitable down the road if we can limit the amount of visits the patients are coming into the office, because Align has provided us with great tools with virtual care now, and PROPEL allows you with VPRO to make the case more predictable, so you don't have to see the patient as often. Every adult patient receives a VPRO inclusive with their orthodontic treatment fee, and we'll talk about that in a second. So the benefits: reduced fees, adds value to your treatment because it differentiates you from the other practices, although there's probably 4 or 5 of you on from our neighborhood right now. That's great, because guess what? I never consider any of you competition. I'm in competition with myself. And if every dentist felt they were in competition with themselves, we would provide the best to our patients and not look to undercut each other. So we want to differentiate ourselves from everybody else who's not doing it. So I don't care if you're across the street from me doing this. Do great dentistry on your patients, and I'll do great dentistry on my patients, and we're all going to be happy in the end. That's what it's all about. So this improves tracking, even for patients that don't exactly do the 22 hours a day, which is many of our patients, okay? It eliminates that inquisition, if you will, when the patient comes in. So tell me how many hours you're really wearing those aligners. I mean, really wearing them now. I mean, actually in your mouth, okay? You know, because you will get lied to a lot, but you know, you'll get the truth a lot too, but that takes it away. Could you imagine just saying to your patient, you don't even ask the question, how many hours a day are you wearing your aligners? You just have them look in their mouths and go, that looks great. Send me some pictures again in another 16 weeks, and you're good to go. That's amazing. You're seeing your patient maybe once or twice for checks for each one of your cases. Look what that does to your bottom line. So once again, we want to reduce the need for refinement and extensive treatment time. So the name of the game is do great dentistry, and if you can get it done in one set of aligners, bingo, that's the name of the game, you win. So the question is, do you include it in your fee? Do you charge extra? Do you throw it in? That's the $1 million question. All right, and we'll give you a couple options here. So if you're going to charge, You can add it onto your fee, an additional $400 to $700 if you want to. What I stopped doing is I don't give it to my patients as an option. I tell them, this is the only way I'm doing your case. And they respect that because they may have gone to 2 or 3 other offices who don't even mention PROPEL to them. And some of them might be your office. If you don't give it as an option to your patient, you have a possibility of losing your patients. But when we explain the benefits of 1 week predictable aligner changes, more comfortable wear of their aligners, less of a chance of extended wear, that's very appealing to the patients, and they're willing to pay a price for that. So I don't present it as an extra cost. I don't make it something that is an option for my patients. This is the way we're doing your case. If you don't like it, that's okay. There are people that will do it without. But if you don't mind wearing the aligners, for 20 months or longer, that's good, okay? Because the price is something that's important to you, but time's not important. So again, we mentioned that this is about high frequency vibration. And the interesting thing about high frequency vibration, it plays 2 roles. So in the retention phase, and this slide is kind of backwards how they show it, but in the retention phase, when you're done with your treatment, if your treatment's done and your patient's wearing retainer, guess what it does? It increases bone density. In retention, it increases bone density. When you're in active treatment, it decreases bone density because it elevates inflammation. So let's flip the active treatment and the retention phase of that slide around. So in active treatment, what we want to do is we want to decrease bone density. We want that bone softer. We want the inflammatory process taking place. So while you're in active treatment, while you're wearing a VPRO, that vibration, that high frequency vibration softens up the bone. Now, when there's no orthodontic force being placed on the tooth, when you're in pure retention phase and you use your VPRO, when the case is over and done, the bone density goes up. How amazing is that? So the same device will do 2 things. Number 1, softens the bone, if you will, in the most generic term, so you'll have a more predictable tooth movement. But in retention phase, it allows the bone density to increase. It decreases cytokine activity. It decreases inflammation, so the bone density increases, and therefore you will have those teeth tighten up quicker and retention will be more predictable. Same slide, different words. The more science involved is, okay, here's your paradox. It's the anabolic versus the catabolic effect, okay? In one, vibration can be utilized to accelerate the rate of orthodontic movement during the catabolic phase, okay? While we're moving the teeth, it increases the inflammation. Subsequently, when you use it during the retention phase, the anabolic phase, and there's no orthodontic movement, it decreases the cytokine activity and increases the bone density. So that one device becomes your friend during orthodontic tooth movement and during retention. So this is more slides to basically bring that point home. 40 to 90% of orthodontic patients relapse within 10 years. That's a huge gap, 40 to 90%. Pick any part of that. When I see a number like that, I split the difference and say, okay, 65% of the patients, 2 out of 3 relapse within 10 years. And we know what happens. They stop wearing their retainers, but sometimes the retainer wear is not enough. Okay, some people just give the patient the retainers and say, just wear them at night. There's all kinds of different philosophies out there. If you go to enough Invisalign lectures, you will probably hear the gambit covered. Okay, but we know PDL remodeling takes 3 to 4 months. Gingival collagen fiber network takes 4 to 6 months. Elastic supracrestal fibers deviated more than 7 months. So it's can take up to 2 years for that bone to totally fill in. Okay, that osteoclast activity to balance out, and that bone to fill in those teeth to become solid. It usually doesn't take that long, but it can take up to 2 years. So once again, here we are looking at the numbers. We have a perfectly finished case, but poor retention. But using our VPRO vibration orthodontic retention, we can help reseat that aligner and get that case back on track again. So if you are wearing your retainers and you have not been real good at wearing your retainers, as it's showing in that middle picture to the left, and you use VPRO 5, so now you're actually applying an orthodontic force on those teeth because it's pushing the teeth back into the finished position. along with the VPRO, you will get that effect that you did, that catabolic effect, where you need to soften up the bone again, get the inflammation increased, and that will get those teeth moved and the aligner seated again. So you can save some cases where you want to, when you have a situation where a patient was not compliant with the retention and you want to be a nice doc and a nice guy or gal out there, you can do that. Okay. Many of you would just go, sorry, we got to retreat the case. Here's what it is. I'll take off the lab bill and you have to pay X number of dollars. And I've done that myself if the case is too far off. But if cases where you don't have a drastic situation where the aligner can go mostly on the tooth, 90% seated, 85% seated, you can use the VPRO to help save the case and help your patient from getting into thousands of dollars of retreatment. And if they didn't do a VPRO initially, I've had a couple of cases where I've sold the patient the VPRO for about $700 versus thousands of dollars of retreatment, and I've saved the cases multiple times doing this same treatment here. So here's the recipe I like to follow whenever possible. I will put my patient in full-time retainers between 60 and 90 days. I will still have them use the VPRO for 6 to 9 months, 5 minutes a day, and then I switch them to nighttime wear. So I have them use the VPRO whenever possible, especially if I've had a lot of mobility of those mandibular anterior teeth. That's how long I'll keep them in the VPRO longer, depending on how much mobility they have in the teeth, just so I can get those teeth to settle down into place and I don't have retention issues down the road. So let's talk about those tough tooth movements with a GP with Invisalign. Okay, we've all had them. What are the toughest tooth movements? We all know this. The maxillary laterals. What's the next toughest tooth movement? The maxillary laterals. And finally, if we bring in these gold, silver, and bronze winner, is the maxillary laterals. Okay, the maxillary laterals give doctors more trouble than anything else. If you've done enough Invisalign, you've seen this multiple times. I don't remember the exact number, but I think it is 17 different combinations of attachments are available for maxillary lateral incisors. Nothing else comes close to the attachments available per tooth. It's either 13 or 17. I didn't add it up before tonight, but they know it. Invisalign knows this is the trickiest tooth to move, and people have trouble with it. It's a combination of the surface area available. It's a combination of root structure, but maxillary laterals give the least predictable tooth movement. This is where we're going to see a aligner gap more than anywhere else. So back to the serious question. Toughest moves, maxillary laterals. Extruding canines is a very tough move. Mandibular incisors for me is my nemesis. Tooth number 25 is my least favorite tooth to rotate in the whole mouth usually. Crowding or spacing cases greater than 6 millimeters. Rotations greater than 40 degrees often give GPs difficulties. And those famous blue and black movements. So how do we capture? What do we do for these tough tooth movements? What's the equalizer? Right there. That's your answer. So when you're into that second and third and fourth, and God knows, I don't want to go beyond that, additional set of aligners, you have to use the equalizer. I'm not going to lie to you. There are cases that I have not started with a VPRO or with PROPEL, but if I'm getting to the second set of aligners, I will hand it to the patient and I will say, I'm going to do this for you. No, there's no additional charge for it because they know if they're not compliant, there's additional charges. But if it's an issue of tracking and I don't feel it's a major compliance issue, I will often just hand them a VPRO and say, you have to promise to use this, and there will be no additional charge for you. So if you have these available in your office, then you can use them. The mistake I made early in my VPRO career, I didn't have them available. I was waiting to order them. I'd wait till I say, oh, I have a patient that I need to do PROPEL on. Let me go order a couple devices and I'll have 2 or 3 in the office. I have a stock of these in my office now. And when you have a stock of them in your office, that's when you use them, because you will look at these cases and go, well, I have a lot of blue movements in this case, or I have that black movement, that rotation of that lower premolar. I've never seen one go, and this is a patient, 64-year-old patient. I don't want to offend any 64-year-olds on here tonight, but a 64-year-old patient where, the bone isn't as soft and as compliant as it is on a 16-year-old patient. And I want to make that predictable. You know what? If you have a box of VPROs in your office, this is where you charge it up, you hand it to the patient, and you say, You need to use this 5 minutes a day, or else you and I are going to end up getting married, and I'm already successfully married and I don't need another spouse. And this is where you have to use, and that's how you successfully implement these devices into your office, is to have them there. If you don't have them there, you will never use them. You will never use this technology. And if you don't have them, the next time you do refinement, remember that you should have had them there, because you could have avoided the refinement or reduced the amount of aligners in the refinement. You may not have 26 aligners in your refinement. Maybe you'd only have 8 aligners in your refinement. So these pay for themselves. I love devices that pay for themselves over and over and over. These devices pay for themselves. That's what people don't understand. When, and no offense to 3M or any of the companies that come to me and say, oh, this is our latest, greatest adhesive, or this is our latest, greatest composite. And of course, it's 20% more than last year's latest, greatest composite, the universal this and the universal plus and the da, 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 da. Okay. You're not going to sell me. Okay. The last composite you sold me, that's the one that you sold me on. These devices, though, actually save you money or make you money. It's just like having a scanner in your office. If you have a scanner in your office, you're not going to take impressions anymore. If you don't take impressions anymore, you're going to save on impression material. That saves you money. If you don't have retakes, if your crowns fit better, that's going to save you money. That's what these devices do. They save you money over and over and over, and they let you do more difficult cases predictably. So we're going to look at just a couple of cases, because I hate showing case after case after case when I'm doing a presentation. I just want you to get the gist of what we're doing here. This is a PROPEL case. You will see some of these in terms of, you'll start counting up aligners and go, he doesn't do 35 to 40 aligners. These are cases that we do. Sometimes they're just to show you studies of what PROPEL will do. Some of these cases are mine. Some of these cases are not my cases. That's my disclaimer. But I will tell you, these cases just show you how predictable a PROPEL case would be. So again, one application of MOPS. That's it. 7.5 months. Many of you would spend 2 years plus doing a case with this difficulty level, rotating those canines, taking care of that severe crowding on the mandible, expanding out those premolars. Many of you would spend 2 years doing this case. Do this case in just over 7 months. Take this deep bite case, okay? This class 1 division 2 case, deep bite, severe crowding. One application of MOPS, 5-month case. How long would it take you to do this case in your office? If you're not using PROPEL, I seriously doubt you'd get this case completed at this level of perfection in 5 months. This is my case. This is my favorite PROPEL case I've ever done in my life. Why is it my favorite? Look at his face. He did not gain weight during the treatment. Okay, my friend Dr. Coddington is smiling at this case because how we expanded this case out beautifully. This guy refused 5 minutes a day of a VPRO. He said, just do what you need to do here. One MOP application, 24 liners, 6 months. Look how his midline shifted. Look how we expanded that case. You might go, look at the perio on that guy. Rock solid case. Rock solid case. No mobility in this case today. You can't do this case without PROPEL or VPRO. You can, but look how long it's going to take you. Look at the expansion under the gentleman's arch. And I was not doing any sleep therapy in my office when I did this case, but I haven't seen him in a while. He moves back and forth between Israel and the States. But next time he walks in my office, I'm going to do a sleep study on him, see where he's at. Here's the clin check. That's what it's all about. Here's a VPRO case. Again, 5 minutes a day, 33-year-old female, 47 aligners. Not my case, but pretty advanced case. All that beautiful expansion. 5 minutes a day. This is my case. Severe crowding, 30-year-old female, 6 visits, 30 aligners, no refinements. VPRO case, religiously. I'm not gonna lie, I think she does her VPRO 2 or 3 times a day because it doesn't bother her at all. So my next slide might be a technical, no, not that one coming up. So everybody likes to have something named after them. I've named this the Mars method, okay? And again, I stress to you how important it is to get my patients compliant so we get through one set of aligners. So here's what I do. 7 days for every case for best tracking, okay? I use VPRO whenever possible, but Monday is aligner change day for every single one of my Invisalign patients. Monday's aligner change day. But Rick, you delivered the aligner on Tuesday. How is Monday your aligner change day? Because I tell my patient your first aligner, if I deliver on Tuesday, I said your first aligner I want you to wear for 13 days. Why do I do that? Because I want a fresh aligner put in the patient's mouth every Monday night. Why? Because if they're going to get sloppy, when are they going to get sloppy? Friday night, Saturday night, Sunday watching football games. Okay, that's when patients get sloppy on the weekends. So if I have everybody putting a fresh aligner in their mouth every Monday, I am reducing the possibility of them being non-compliant during the most important time that they're wearing an aligner. So even if they're changing a aligner on a Thursday or Friday, and I got them wearing it, and then they have to go out to dinner Saturday night, okay? Or we have some religious people in my neighborhood who tell me flat out Friday night dinner, my aligners are off 4 or 5 hours because we sit around the dinner table together. And those patients, that's a recipe for refinement right there. So we have everybody switch to Monday night change of their aligners. They change them every Monday night. And then when I throw a VPRO into the case, that's where success, that ensures my success, is I'm going to have good aligner tracking almost every single time. Finally, what else do I do? Customer service, ladies and gentlemen. Every Monday night on a new patient, when it's aligner change night at the end of the day, my assistants call those patients that week. Not every patient for every aligner, their first aligner, they call them and they check in. Remind them tonight's change night, make sure everything's going okay, keeps them on track, checks in, sees if they have any issues, and we become superstars in the patient's mind. So bear with me on the audio here. I'm going to get a clue if this works or doesn't work. So let's see, because if it does, hopefully you will laugh.
An elderly woman goes to the dentist, and the dentist says she needs Invisalign. She says, but what if I die tomorrow? Suddenly she hears this booming voice, and this voice says, you're going to live another 20 years. She's okay, great, I'll get the Invisalign. After the treatment is over, she walks out the door, gets hit by a car, goes up to heaven. God, she says, you told me I was going to live another 20 years. He said, I'll tell you the truth. I didn't recognize you.
Well, I hope you got that joke. If you didn't get that joke, I'll explain it to you in person, but you had to pay attention there. Over 80 years old, starting Invisalign. How's that? Okay, so we are on track here. We have time for a couple of minutes of questions. We're actually a little over, but I am going to open up my question box here and allow just a few questions. Okay. Can one just use the VPRO and not do the MOPs? 100%, Terry. Okay, if you have a situation, the only time I personally would do both, if I had an incredibly difficult, let's say we were rotating it to 70 degrees, okay, something crazy that you or I might try to do something just to do it, okay? If we got it all the way, that would be great. So in that case, I might consider doing MOPs and then introducing a VPRO too, but no, I would do one or the other. And once again, most of the patients are preferring to do just the VPRO. The VPRO is amazing. 5 minutes a day. You're really not asking the patients to do a lot. They can do it anytime. They can do it in their car. And while they're watching TV, you know, it's so simple and easy to use the VPRO that's where most patients are opting to do. Some doctors don't like to have to worry about numbing the patients up and doing that intraradicular tiny little micro-osteoperforation. Some people get nervous doing that. So the VPRO is the great answer. And the VPRO's really become a huge, easy part of my practice. I would tell you without a doubt, the ease of the VPRO is really what makes it exciting for most of the patients. But you can do one or the other. You don't have to do both. Between PROPEL and MOPS, which had greater impact? Said they both sum up to 100. Oh my God, Chad, that talk about on the spot question. I have to tell you that that's a tough way to ask the question. All right, I use them for different things. I showed you the one case that I did basically the whole mouth with MOPS, because that was a case, and that was wonderful. I am just as confident doing MOPS in the whole mouth, if that's a situation that I do, as doing as doing VPRO in the whole mouth. So what you want to ask is, if you had to pick one or the other, which one would you pick? I'm as comfortable doing confidence-wise in terms of predictability. I think one's just as predictable as the other. I would do, like I said, I choose to do MOPS in a situation where a patient for some reason says, I'm not going to use that device. I'm just not going to do it. I'll wear the aligners, but I'm not going to use any more devices. Do something else. And if I have an option to do something else, then I'll do MOPS in the office. I will do MOPS if I have one difficult tooth in the mouth that I really want to focus in on, then I'll do MOPS. So, you know, that's my deciding factor. What is the cost of the VPRO? So the VPRO is very much like Invisalign in terms of you have a situation where it all depends on how many you buy. So it's the price range from about $300 to $299 to $499 is the general price. If you buy them in bulk, obviously you can get the price down. It's just like Invisalign, it lowers your lab bill the more you do. So, but think about it. Again, I will tell you, Vivian, I think as dentists, we get very funny because we focus on what is the cost, but we don't factor in what is the bottom line. And the bottom line I say to you is, hey, Viv, if you're going to spend $500, if you bought one VPRO, okay, if you pay top dollar for VPRO, if you didn't buy them in bulk, $500, I argue it costs you more to do additional liners than $500. So if you can reduce the number of additional liner cases you do, and you buy the VPROs in bulk, and you're paying $300 for a VPRO, that's a no-brainer, because you are absolutely, at the end of the day, going to just save on that chair time, have happier patients, get patients, refer other patients to you. So it's really something that the cost of it is something you need to know. It's a good question what you're asking, but understand it's the bottom line at the end of the day. The bottom line at the end of the day is if you can afford doing a refinement, who on this call wouldn't pay $500 or $300 even if you're buying them in bulk to avoid doing a refinement? I would do that all day, every day. If you gave me a 90% guarantee that my cases were going to go without any additional aligners, I will tell you I would be thrilled at the end of the day to be able to do that. The handpiece for the PROPEL, I don't know the exact cost on the handpiece. There are two different models. There's one where the electric handpiece is, I'm going to guess, but don't hold me to it, Terry, is about $1,500, but I could be wrong. And there's also a handheld driver that you can use also, where you pop them in, and that's considerably less. But your rep, if you ask your rep, they will let you know about the handpieces, what the cost on the handpiece is at the end of the day. Okay, so we ran over a little bit. It is 8:13. I will take one more question. So the last question is, how does PROPEL help you do more Invisalign? So I'll tell you how PROPEL helps you do more Invisalign. Number one, they support you. This is one of those companies, they are independent companies, and that's what I think is amazing what's happening here tonight with PROPEL and Align doing. This is the first lecture I've done for both together, where they're both sponsoring the lecture tonight. but PROPEL helps support Invisalign. PROPEL knows that if they can make your Invisalign job easier and your cases more predictable, you're going to be more comfortable doing more complex cases as time goes on. I'm doing cases now that I wouldn't have dreamed of doing 10 years ago. I had patients when I originally came in and started doing Invisalign, I said to them, I think you need to go to the local orthodontist because I'm not comfortable doing these cases. And they never went. And they said, I don't want to go to the orthodontist. I don't want to be in an office with a bunch of kids, and I don't want to leave your office. I'll do it in your office, but if you're not doing it, I'm not ready to do it. Meanwhile, 2 years go by, 3 years go by, I got more and more experience, and I got better at doing more difficult cases. And that's what PROPEL does. It allows you to do more difficult cases because you're going to see the predictability. You're going to trust the aligners more, what they can do for you, and you're going to do more Invisalign at the end of the day. And mind you, Invisalign doesn't love you to do, they don't want you to do 2 or 3 or 4 or 5 sets of additional aligners, because that's a cost to Invisalign. So they go hand in hand at the end of the day. These two companies love each other, because if you're reducing the amount of additional aligners, Invisalign's putting less into the case and has to spend less on your case when they're done at the end of the day. So that's a win for Align. And it's a win for PROPEL, because PROPEL's getting to sell their devices to you. But bottom line, you're not here to support Align or PROPEL at the end of the day. You're here to do more cases. And these two devices hand in hand will allow you to do the best cases you can do, more predictable cases at the end of the day. And that's the name of the game. Do more cases, make them more profitable, and that makes everybody happy. So with that, I want to wish you all a good night and stay safe, everybody.